All right, what is number 13?
The number 13 is calcaneum.
Do you want to say the side? Is it right or left calcaneum?
Sir, it's left calcaneum.
What is 15?
Sir, 15 is navicular bone.
Yeah, so again, we're gonna say always say left navicular bone. All right. What is number
left
18?
navicular. Sir, number 18 is sir sustentaculum tali of the left
Okay,
calcaneum.
excellent. What is 11?
Sir, number 11 is sir medial malleolar surface of LS of the left foot.
Yeah, simply it's medial malleolus of the left
Okay.
side. Okay. Yeah.
Okay.
What
Okay.
about 10? What about 10?
Sir, number 10 is sir medial cuneiform of left foot. Left
Okay.
medial cuneiform.
Okay. What is 21?
So 21 is navicular tuberosity.
Okay. Good. What is 6?
So 6 is lateral cuneiform.
Is it lateral or medial?
So
Intermediate.
that's sir, it's lateral.
Lateral. What is 5?
So 5 is intermediate cuneiform.
What is 2?
So that's cuboid.
Cuboid bone. Excellent. So we talked about the calcaneus, and we just mentioned that this 13 is the calcaneus. That's the other thing that you can see, but 18 is basically sustentaculum tuli, like we mentioned that. We talked about the talus, and we explained the medial and lateral malleolus. Obviously, the lateral malleolus is 7. And we talked about navicular bone, it's 15, and its tuberosity 21. We talked about kyphoid very quickly, and cuneiform. Talked about all of them, and also the metatarsal. Base 5th is just right there. But I think, yeah, that's it. Okay. What
Okay,
are
sir.
the arches of the foot? Can you mention the arches of the foot, including the bones forming them and the ligaments and muscles related to them?
Yes, sir, I can. Please show me the diagram.
There is no diagram that you would see. I'm
Okay,
just
sir.
asking you. Tell me about the arches.
Okay, sir. Sir, there are 3 arches of the foot. One is medial longitudinal arch. One is lateral longitudinal arch, and one is transverse arch. Sir, first of all, we will come on the medial longitudinal arch. Medial, sir, the bones. First, we will discuss. So, medial longitudinal arch is formed by calcaneum, callus, navicular bone, so 3 cuneiforms, and medial side 3 metatarsals. And ligaments are introitious ligament and a deltoid ligament, short plantar ligament, long plantar ligament, and spring ligament. Now, sir, we will come on the lateral longitudinal arch, and lateral longitudinal arch is formed by calcaneum, cuboid, and lateral 2 metatarsals bones, and lateral side longitudinal arch is supported by the ligaments are uh, short plantar ligament, introitious ligament, and long plantar ligaments. So now we will come on the transverse arch, and transverse arch will be found by the bones all head of the metatarsal bones, and 3 cuneiforms and 1 cuboid. And in the ligaments that support the transverse arch is introitious ligament.
Okay. That
Yes,
is
sir.
perfect. That was really good. I think you've said all of them correctly. So starting by,
Thank you, sir.
but I'm not sure if I asked you about the muscles. Yeah, the muscles
Yes,
were
sir.
there. Maybe you skipped them, but it's fine.
Yes, sir. I can explain them.
Yeah,
Sir,
go for it. Go for it.
yes, sir. Sir, lateral longitudinal arch is supported by the peroneus longus and peroneus brevis, and the medial sides are supported by the tibialis anterior, tibialis posterior, and flexor hallucis longus muscle and peroneus tertius. And sir, the transverse arch is supported by the muscles. Sir, I am not sure about that. I think there is no muscle
It's going to
about
be the
that.
peroneus as well. The peroneus as well, but that's
Oh,
fine. I
okay, sir.
think
Oh,
you covered it very well. So you have 9 bones in the medial, and this is calcaneum, talus, navicular, and 3 cuneiform, and medial 3 metatarsals. The ligaments, like I said, short and long plantar ligament and spring ligament. As simple as that. You don't have to say the deltoid, but if you said it, that's fine. But short and long plantar and the spring
yes, sir.
ligament. The
Yes.
muscles, tibialis anterior, posterior, FHL, and peroneus longus. Okay. The lateral longitudinal arch, very quickly. The bones are calcaneum, talus, cuboid, and lateral 2 metatarsal. That's on the other side. As you can see, those two are, the calcaneum and talus are sort of on both sides anyway. And the ligaments, short and long plantar, and the muscles, peroneus, longus, and brevis, and also the short plantar muscle as well. Transverse arch, bones, that will be the metatarsals, and muscles is the peroneus longus muscle, like we said. Yeah, well done. What are the joints of the foot? Let's start by the subtalar joint. What
Yes,
are
sir.
the how is it formed? The subtalar joint.
Sir, first of all, subtalar joint is a type of a plain synovial joint, and it is formed by, sir, the union of two bones that are, sir, calcaneum and talus bone. So this is basically calcaneal joint. This is plain synovial joint, and the movements that occur at the subtalar joints are, sir, inversion and avarian. Yes, sir.
Okay. What about the talocalcaneonavicular joint, the TCN joint? Can you tell me the
Yes, sir.
bones forming it and also the
Sir,
movements as well?
sir, it's formed by three bones: calcaneum, talus, and navicular bone. This is, basically ball and the socket joint, and this also support the inversion and eversion of the foot.
Okay. Yeah, I think there is one more joint we can ask about, the calcaneocuboid, but that's fine. It's just a plain synovial joint
Yes, this is
between the
also plain
calcaneus and the base. Yeah,
Yes.
inversion and avulsion. Okay. What is the metatarsal joint? How is it formed?
So, mid-tarsal joint is basically union of two joints, so that are calcaneocuboid and talocalcaneonavicular, and they form the joint with the basis of the five metatarsal bones. So that's all, sir, about that.
Yeah,
Mid-tarsal joint.
yeah, yeah, that's right. The two separate joints aligned transversely. That's the talonavicular joint and calcaneocuboid joint. Obviously, one is ball and socket, and the other one is saddle. All right. So the ankle joint. What are the bones forming the ankle joint?
Yes, sir. It's formed by, sir, tibia, fibula, and, sir, head of talus bone, and basically it supports the movements of dorsiflexion and plantar flexion of the foot.
Okay. The tibia, fibula, and the trochlear end of the talus, and it's a synovial hinge joint. That's fine.
Synovial joint.
The movements. What are the movements of the ankle joint and the muscles involved in that?
Sir, I have already explained the ankle joints is involved in the movements of dorsiflexion and plantar flexion of the foot. Sir, the dorsiflexion is done by the anterior side muscles, and that are, sir, tibialis anterior, tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. And, sir, plantar flexion, sir, is done by the muscles of the backside, and that are, sir, tibialis posterior muscle, and that is flexor hallucis longus, flexor digitorum longus, and, sir, gastrocnemius, soleus, and plantaris.
Well, the knowledge, which is really good. I really like that. There is also something that is really important is how you communicate your knowledge to your examiner. I think you have lots of knowledge, which is really good, great. But the way you communicate it, try to make it a little bit organized, take your time, and you don't have to, keep saying all of them. Just take your time and say, well, I will start by the dorsiflexion, and it's done by the
Yes,
muscles of the anterior compartment, and this
yes, sir.
includes four muscles. That's the tibialis anterior, extensor digitorum longus, and extensor hallucis longus, and peroneus tertius. Okay,
Okay, sir.
and
Okay, sir.
the dorsiflexion is done by the muscles of the posterior compartment, and this is divided into superficial and deep. The superficial
Yes,
part of the posterior compartment include gastrocnemius, soleus, and plantaris. And
yes,
the
sir.
deep compartment is formed of this and this and this, and so on. All right.
Okay,
So I think, because part of the assessment and the knowledge is actually your professionalism and how you
yes,
communicate
sir.
as well. It's not only about the knowledge. All right. So we talked
Yes, sir.
about the plantar flexion, and this is the three muscles, superficial, and those the deep muscle, tibialis posterior, hallucis longus, and digitorum longus. All right.
Okay,
And
sir.
we talked about the anterior. Okay. Well, you're going to be asked to demonstrate dorsiflexion and the plantar flexion and at which joint this movement happen.
Okay, sir. Sir, dorsiflexion means you are moving your foot towards the body, and plantar flexion is the movement of the foot away from the body. So these movements are occur at ankle joint.
Can you say the joint again?
Uh, Sorry, sir.
Did you say ankle joint? Is that what you said?
Yes, sir. Yes, sir. I said
Okay,
ankle joint. Ankle
great. So why the ankle is more stable in dorsiflexion?
because sir, in the dorsiflexion, the anterior wider surface of the talus is perfectly fit in the ankle mortise, and there is no gap in between. So that's why the uh, uh, dorsiflexion is more stable as compared to the
Okay.
plantar
So
flexion.
again, you do understand. You understand the basics of it, but like I said, the communication to your examiner is very important. So the way I'm
Yes,
going to
sir.
explain this, I'm going to say the talus bone is usually wide anteriorly
Yes.
and narrow posteriorly. So in
Yes.
dorsiflexion, the wide part
Yes.
of the talus will fit in the ankle mortise because it's
Yes, sir.
quite wide, so it's going to fit in the ankle mortise and it will create a better grip. And then in
Okay, sir.
plantar flexion, the narrow part will fit in the ankle joint, but it will be a little bit loose or wobbly. All right. So that's
Yes.
what the way I would explain it, to be honest. So the anterior
Okay, sir.
portion is wider than the posterior portion, and then you say in dorsiflexion this will happen, and in plantar flexion this will happen. Okay.
Okay. Okay.
So inferior tail. What is the type of the inferior talofibular joint?
So, inferior fibular joint. So this is a type of joint, basically. So,
I think it's
syndesmotic.
meant to be tibiofibular joint. Let me just change that.
Fif-
It's
15
tibio.
minutes.
Yeah. Thank you. That's the last question. Tibiofibular ligament.
Sorry, sir.
So what is the type of the
Okay,
inferior
sir. This is
tibiofibular ligament?
syndesmotic.
Syndesmotic. All right. And what fracture can cause syndesmosis injury?
Sir, Weber C fracture.
Okay, excellent. So Weber C fracture, well done. Great. Yeah, I think your knowledge is great in terms of the osteology of the lower limb. But like I said, the only feedback I'm going to give to you is take your time. Do not answer until you have organized your thoughts, and then start
Okay, sir.
like in a very organized way, say your answer. But thank you. Less than 15 days, so you need to be ready for everything. Okay.
Yeah.
All right. Proximal tibia. Which side of the body is this bone?
This is the anterior surface and yeah, yes. This is the right tibia.
The right or left? Can you give me single answer?
It's the one. Just a second. It's the left.
Okay. What is 14?
14 is the tibial tuberosity.
What is 4?
4 is the attachment of the iliotibial tract, the Gerdy's tubercle. So this should
What
be
is 9?
9 is the medial condyle of the medial.
9 is medial. Okay. So check the answers. So you have, this is the left tibia. That's correct. And we asked a few questions about 9. 9 is the medial condyle. And we also asked 6. I think 6 is lateral condyle, but 4, like you said, is the iliotibial tract impression. Not sure if you said iliotibial tract, but it's the iliotibial tract impression. Okay.
Yeah, I said
Good.
Gerdy's tubercle.
Okay, sounds good. Great. Okay. What is 1?
It's the coronoid process of the fibula.
Is 4?
That's the head of the fibula.
Okay. This one, what is 8?
That's the lateral condyle of the tibia. Articular surface.
The left tibia.
Left tibia.
Yeah, what is 6?
6 is the fovea of the fibula, left fibula.
No, you don't. Yeah, we talked about it just a few minutes ago. We talked about the joint in this area.
The syndesmotic joint of the lower end of the ankle.
Yeah, you can say inferior
Inferior
tibial
right.
joint, right?
Yes.
Okay, 11.
11 is the medial malleolus of the left tibia.
9.
9 is the lateral malleolus of the fibula.
Okay, sounds good. Let me just check if we missed anything. Yeah, I think pretty much okay. Yeah, quite quickly, we're gonna do the femur. So what is 4?
This is the posterior surface. So this is the right femur, head of the right femur.
That's a good question. Is it right or left?
It's left. Sorry, yes.
What is 4?
The head of the left femur.
Okay, what is 11?
11 is the neck of the left femur.
What is 12?
12 is the intertrochanteric line. The impression, I think, is the tubercle. Quad.
12.
Quad.
Say it.
It's
Say it. You're on the right line.
Yeah, the quadrangular tubercle.
It's a quadrate tubercle.
Quadrate.
Okay.
Yes.
Or quadrate tubercle. Okay. What is 5?
5 is the greater trochanter. The
What
tip
is
of the
8?
greater trochanter. 8 is the lesser trochanter.
Okay.
Of the left side.
Sounds good. Okay. Great. I think you've covered them quite well. So like we said, this is the left femur. Somebody just came in. What did you want to say?
I'm trying to say 5 is not in the greater trochanter. Greater trochanter is number 3.
5 is the intertrochanteric
crest.
Is that correct? Do you agree with that?
Yes, right.
Yeah, so posteriorly you have the crest, anteriorly you have the line.
Yes.
Yeah, so I'm not sure, Samir. To be honest, I forgot what you said, but in my mind it was crest. What did you say?
No, I said greater trochanter for 5.
No, it's not greater trochanter. It's
Yeah.
intertrochanteric line. 3 is the greater
Okay.
trochanter, and 8
Yeah, the
is the
5
lesser
going down
trochanter.
all the
Right?
way. Right.
I'm sorry.
That's right.
I'm sorry I didn't correct you, but to be honest, in my mind, I was just saying it as a crest. Okay. All right. So can you tell me the attachments to number 3, which is the greater trochanter?
The greater trochanter gives attachments to the gluteus medius and minimus, along with all the short external rotators of the hip, like the piriformis, the gemelli, and the obturator internus.
Okay, so attachment gluteus medius, minimus, piriformis, obturator externus, and internus. Okay, lesser trochanter, attached structures.
The iliopsoas tendon.
All right, iliacus and psoas major or iliopsoas, that's fine. What are the attachment, or what is the attachment for quadrate tubercle? Number 12.
I'm not too sure.
Okay, from the name, can you guess?
Quadratus femoris.
Yay, right. Okay, from 1 to 10. I mean, to be honest, these. Yeah, we can just do it quickly. 3.
It's the head of the femur of the left side again.
Yeah, 4.
The intertrochanteric crest. Lesser
Crest or line?
trochanter.
Intertrochanteric crest or line?
Well, the intertrochanteric line, yes.
Okay, what about 5?
The lesser trochanter.
2?
And the greater trochanter.
What about 11?
The piriformis fossa.
1?
The fovea.
Okay, well done. I think you said it. You said them correctly. I'm sorry. The fossa is called trochanteric, not piriforms. Okay. What about 8 on this side?
The medial condyle.
5?
The lateral condyle.
1?
The medial epicondyle.
I might need to check 1, but I don't think. No, actually, I think it's epicondyle because 6 is the lateral epicondyle, is it? I
Okay.
will need to check 1. Yeah, that's what I was
Adductor.
thinking. One is adductor tubercle.
Adductor tubercle. Okay.
Yeah, one is adductor tubercle, and 8 is the, like you said, and 5, and then the lateral epicondyle on 6. Okay. What about 10?
It is the
You're on the medial supracondylar ridge, I believe, or something like that. Yeah, medial supracondylar ridge. Okay. Good. Continuing on osteology. I think this one is quite difficult, to be honest, and I'm not really sure if the exam will bring something like this, but let's skip this one for now. And then finally the hip bone, and will be done by osteology. I'm sorry, the picture is quite big, but this is as a whole. This is the hip bone, and we need to identify a few structures. What is 10?
it's the iliac crest.
Okay, I'll ask you about left or right at the end, but you can just say the answer now, and then I will ask you about left and right. Okay, 10 is iliac crest. What is 28?
The iliac tubercle. I think it's the
Okay.
left iliac bone.
Yeah, when you hold it by, yeah, I think it's the left. Yeah, good. What is 21?
21 is the posterior gluteal line.
3?
Anterior gluteal line.
What about 12?
Inferior gluteal line.
Okay. What about 9?
That's the greater sciatic notch.
What about 17?
Lesser sciatic notch.
What about 14?
Ischial spine.
Okay, well done. What about 2? Quite easy one.
Yeah, acetabulum.
Okay. What about 19? Is there?
19 is the obturator foramen.
Okay. What about 24?
The pubic tubercle.
Yeah. Yeah. So let me check the 24 again very quickly. Yeah, pubic tubercle. Okay. Yeah, well done. I think you said all of them correctly, and it's the left side, like you said. A little bit of muscles. What are the muscles involved in the subtalar joint?
The subtalar joint causes eversion and inversion. So eversion occurs when there is a combined action of the tibialis anterior and posterior.
Can you say again?
Inversion is caused by the combined action of the tibialis anterior and posterior, and eversion is caused by the action of the peroneus longus brevis and brevis.
Yeah. Do you have any of the hallucis muscle involved in these movements?
In inversion, the extensor hallucis longus.
So, and the flexor as well. So all the muscles will be involved in the inversion. Tibialis anterior and posterior, and the extensor and the flexor will do inversion as well at the subtalar joint. Lateral, like you said peroneus longus and brevis. Did you say that?
Yes.
Yeah, really good. What are the structures behind the median malleolus?
Starting from anterior to posterior, it is the tibialis posterior, the flexor digitorum longus, the posterior tibial artery, the tibial vein, the tibial nerve, and finally the flexor hallucis longus.
Yeah, tibialis posterior, digitorum longus, flexor, and posterior tibial vessel nerve, and flexor hallucis longus. And obviously this Tom, the mnemonic that the Tom does very nice at.
Yes.
Okay. What are the structures deep to extensor hallucis longus?
The dorsalis pedis artery and the interdigital nerve.
I want you to raise your voice and say it again.
The dorsalis pedis artery and the interdigital nerve branch of
It's
the
not
anterior.
interdigital. It's the deep peroneal nerve.
The deep
All right.
nerve.
Yeah. What makes the Achilles tendon?
A combination of the gastrocnemius, soleus, and the plantaris muscle.
Excellent. Well done. And identify 8 and 14 on this diagram. So that is 8.
It's the interdigital artery.
What about 14?
14 is the extensor hallucis longus tendon.
I want you to do 13 as well, if you'd like.
Okay, 13.
That's extensor hallucis brevis. So you have the longus here, the brevis is there.
Okay.
That's the origin and the going to insertion. All right. What is 15?
The dorsalis pedis artery.
Okay. And you're going to say 16 as well, if you'd like.
16 should be the deep peroneal nerve.
Yeah. It's called interdigital nerves of the deep peroneal, but yeah, you can say deep peroneal wouldn't be wrong, I believe. Okay. And obviously 7 is quite obvious, right?
Yes. Extensor digitorum.
What is 7? Excellent. And longus, you're going to say longus, right?
Longus.
What is 1? What is 1?
The extensor aponeurosis.
There's no aponeurosis in here. Is it retinaculum? Is that what you meant?
Retinaculum, yes. Extensor retinaculum.
Yeah, well done. Well done. I think you've done very well. I think nobody had the time for us. So is that okay if we move on to the next person?
Yes, that's fine. Thank you.
Okay, thank you. Thank you. You've done really well. I like knowledge and I like how you communicate it. You're very calm as well. That's really good. Keep doing that.
Yes, thank you.
Okay.